I'm Dr. Jeannie Huang, Associate Professor of Pediatrics at the University of California, San Diego, and at Rady Children's Hospital. I've been invited by the editors of Clinical Gastroenterology and Hepatology to discuss with you our paper entitled Clinicians Poorly Assess Health Literacy-Related Readiness for Transition to Adult Care in Adolescents with Inflammatory Bowel Disease. Transition is the planned transfer of patients from child-centered to adult-centered care. Ideally, this would occur when the adolescent has been fully prepared for this event. However, in reality, this event often occurs when the adolescent reaches a stipulated chronologic age as dictated by their insurance plan. Unfortunately, this often translates to poor transition experiences, and poor transitions have been associated with poor health outcomes. We sought to evaluate health literacy-related readiness for transition in adolescents with inflammatory bowel disease. We also wanted to correlate this with clinicians' assessments of readiness for transition because we felt that clinicians should be aware of their patients' readiness for transition in order to identify patients at risk and provide them with additional resources so that they might improve their transition experience. When one thinks about what an adolescent needs in order to successfully transition, one recognizes that in regards to health literacy, the adolescent needs much more than just basic reading skills to just read and comprehend health information. He or she must also have a working knowledge of inflammatory bowel disease, must be able to manage his or her own disease, and finally must also be able to advocate with the healthcare system for their own unmet healthcare needs. Therefore, in order to have a global picture of health literacy in this population, we used 4 literacy scales. First, we used an adult functional health literacy assessment, or the TOEFL, in order to assess the adolescent's ability to read health information at an adult level. We also then used 3 interactive health literacy measures. First, we asked the adolescents to fill out a new patient information form as they typically would at their first healthcare visit in the adult system. Second, we asked them to fill out a self-efficacy scale in regards to their ability to manage their own disease. And thirdly, we asked them to fill out a scale assessing their working knowledge of inflammatory bowel disease. "74 youth were recruited into the study. 35 were male and 42 had Crohn's disease. The median age of our patient cohort was 15 years, and the median duration of disease was 3 years. In regards to literacy assessments, 74% met adequacy in regards to being able to read and understand adult health information. 78% were able to fill out their new patient information form successfully and accurately. In contrast, only 16% had a working knowledge of inflammatory bowel disease, and less than half reported confidence in their ability to manage their own disease. When we defined health literacy readiness for transition as having adequate scores on all 4 literacy scales, only 11% of the cohort met this criterion. In contrast, clinicians assessed 47% of the cohort as being ready to transition as defined by having adequate health literacy. In summary, we demonstrate that clinicians have a very different view of health literacy in regards to readiness for transition, and that it is quite different from actual literacy scale measured readiness for transition. This discrepancy, we feel, speaks to poor awareness of health literacy issues in this population. We also have found poor health literacy in general in our population of adolescents with inflammatory bowel disease. Our data suggests that interventions are needed in order to improve health literacy and health literacy awareness in this population and amongst their providers or the healthcare providers. And our hope is that via such interventions, that the transition process from pediatric to adult-centered care might be improved in this at-risk population. Thank you very much.